Dear audience, dear chair, my PhD topic are the fixation techniques used in the therapy of jaw fractures. My name is Petra Papócsi. I'm a PhD student and an oral surgeon at Department of Oral Maxillofacial Surgery and Stomatology. My supervisor is Zsolt Németh and my SMS is Kata Kelemen. You can see here my statisticians as well. My vision is to learning and utilizing the latest techniques in case of patients with jaw fractures, and my mission is to use a faster and more comfortable splinting technique during the night duty. You can see here my specific goals. My first is to investigate the effectiveness and safety of the currently used methods in treatments of jaw fractures. And my second one are the maxillofacial injuries related to the e-scooter usage. My first project is a network meta-analysis and a systematic review. In case of fractures which involve the dental occlusion, we have to use the intermaxillary fixation or maxillomandibular fixation to re-establish the occlusion and to control it. Why is it important? Because the mandibular fractures are the second most frequent facial injuries, more common in males in their 20s. And these fractured ends must be fixed, not like in the picture, because if you don't do that, there could be many bite and functional differences, aesthetic differences, and inflammation as well. The fixation can be achieved in two ways: in a conservative way with closed reduction, and in a surgical way with open reduction and internal fixation. On the first picture, you can see the Eric arch bar. It's the gold standard and most used techniques, where we use two arch bars fixed by interdental wiring, and it provides a stable technique for us, but it's really painful for the patient, and it can cause many needle stick injuries, and the oral hygiene maintaining is really difficult with it, and it's time consuming as well. That's why they have started to use the IMF screws, as you can see in the second picture. It's the 4-point fixation system. It's easier to use and shorter time to applicate, but we can cause many iatrogenic injuries with the self-stepping screws. The hybrid MMF technique, as you can see on the last picture, is to use the advantages. And we use two arch bars with self-stepping screws, but we can cause many iatrogenic injuries with it, but it provides good stability as well. So our aim was to compare these three techniques and reduce the complications and the surgery time. Our clinical question was that is there any difference in effectiveness and safety of the currently used methods in treatments of jaw fractures? Our population were adult patients who need the IMF and has jaw fractures. Our intervention and comparator were the Eric arch bar, the IMF screws, and the hybrid technique, and you can see our outcomes in the plot. We would like to create a time-efficient and safe technique for patients and doctors as well. You can see here my systematic search and my final search key. Initially, I had more than 20,000 hits, and after the duplication removal and the selection, I have now 29 eligible full text. We have divided the outcomes into safety and efficacy outcomes, and the statistician analyzed all the outcomes for only RCTs and for the total, the RCTs and non-RCTs as well. But due to the lack of time, I would like to present only some outcomes, some main outcomes, which were from the RCTs. At first, I would like to start with the application time, which was measured in minutes. On the left side, you can see the network plot, where the edges shows the comparison numbers, and the dots shows the treatment times. On the right side, you can see the P-score ranking. The better it ranks, the value is closer to 1. We can see that the IMF screws reach the first place, so it's the most time-efficient treatment type, followed by the hybrid technique, and the Eric arch bar was the most time-consuming. On the leak hit table, on the left bottom, we can see the point estimates numbers and the confidence intervals, and the direct and indirect pooling together, so it's the network. It shows us that the application of the IMF screws are about 47 minutes less than the Eric arch bar, and the application of the hybrid technique is about 33 minutes less than the Eric arch bar. These results are clinically relevant and statistically significant as well. My next outcome would be the iatrogenic injuries in relation to patients. These injuries are caused by the devices, for example, the root injuries and the vitality loss of the tooth. On the left side, you can see the network plot with the involved studies, and on the right side, the P-score ranking, where we can see that the Eric arch bar was the first one. So the less iatrogenic injuries happened with using the Eric arch bar, followed by the IMF screws, and the hybrid was the last one. On the leakage table, we can see that a third of injuries happening if we use the Eric arch bar compared with the IMF screws, and 1/4 when we use the Eric arch bar, not the hybrid technique. These are clinically significant, clinically relevant, and statistically significant results as well. I would like to show my table about the cost analysis. We couldn't make any meta-analysis of that, but I think it's important. We couldn't pool these amounts because of inflation and the regional differences, but we converted everything into dollar, and after that we converted it into $23, where we could see that the Eric arch bar price is about $60, the IMF screws price is about 6 times higher, and the hybrid technique is about 20 times higher. The strength of our analysis is that it's a network meta-analysis with homogenic populations, with direct and indirect comparisons, but we had some limitations as well. So overviewing, we should say that the IMF screws and the hybrid technique are most effective in application and removal time, oral hygiene maintaining, and patient acceptance, and safe in case of needle stick injuries, but there's a higher risk for iatrogenic injuries and inadequate occlusion. But we recommend to use a wider of the IMF screws, but we have to discuss the patient about the safety and the efficacy parameters, and we need more multiple arm studies for research. You can see here my first project progress, and the manuscript status. Our target journal is the top journal in oral and maxillofacial surgery. My second topic are the maxillofacial injuries related to the e-scooter usage. The e-scooters are a part of the urban micromobility because they are highly available, environmental friendly way to transport, and they are cheap. And you can use them with an application if you don't have one. But there are no restrictions for speed or speed limits, for helmet usage, or driving under the alcoholic influence. So that's why it's important for us, because we have recognized that the most common injuries are face and head and neck injuries, for example, fractures and soft tissue injuries in case of young, drunk people at night, in our clinic as well. So we would like to highlight the danger and identify the risk factors. A clinical question was that what are the risk factors and what is the prevalence in different maxillofacial injuries in adults related to the e-scooter using. We would like to see the maxillofacial injury types and the risk factors in context of the e-scooter using in adult patients. You can see here my systematic search and my finalized search key. And at first, I had more than 1,000 hits, and after the application removal and title abstract and full text selection, 33 eligible articles left. So now we are going to have a citation chasing, and after that the data extraction phase. Our articles are from the latest 2 or 3 years, so it's a hot topic. And you can see here again my goals with the planned submission dates. And I would like to close my presentation with the words of Dan Brown, that everything is possible, the impossible just takes longer. Thank you for your attention.
So congratulations to both projects, actually. My question would be, do you think, is there any relation or connection between the application time and a iatrogenic injury? Or in other way around, like, is there a way how we can improve or decrease this iatrogenic injury in one of the treatments? Thank you.
Thank you for your question. I think there's not too much relation, because the application time depends on the technique, and I think the iatrogenic injury is because we are using the self-tapping screws, but they help us and provide us a longer technique. So maybe that one, but the hybrid technique was created to use that advantages, but we could see on the plots that it was not possible. So they have tried to use the arch bars with the self-tapping screws, but it wasn't so successful.
Thank you for your nice presentation, Petra. And I'd like to know what's the purpose of the second project regarding the policymakers. Do you plan to do something like guidelines for the usage, for example, as we have for travel or as we have for drive? I'm sorry.
Thank you for your question. In our clinic, we could see many fractured patients with that problem or with bicycles or violence. So that's our aim, to make a guideline or to achieve something with a roller, with a scooter using, sorry. We would prefer if they couldn't use it from midnight until 5 o'clock, or they should wear helmets, but it doesn't protect the face, so it's a hard question.
Don't drink.
Yes.
My question will be about your first topic, that in the clinical practice, which type of treatment do you use from the mentioned three?
Thank you for your question. We use at our clinic the Eric Arch bar because it's the gold standard, and it's really easy for the resident doctors or anybody to apply, but it's so time consuming. But we use that because of this because of this reason, and we could see, and that's why I would have liked to talk about the cost analysis, because we could see that it's cheap. And we have many patients who has fractured jaws.
Yeah, I see. Thank you.
Thank you.
I just have one comment to add. In Hungary, there are rules for the usage of e-scooters. And more European countries come up with rules for them. It's just another question that they are not followed and they are not enforced. So there are clearly defined rules of road to how to use an e-scooter.
Thank you.